Okay, we'll give people just a few minutes so they can log in, but in the interim, let me use this time to share some ground rule to ensure quality engagement during the next 90 minutes. Please note that the webinar will be in French and English, so choose your channel from the beginning just to be comfortable. We will have two segments for our dialogue. The first segment will be a conversation between the speakers, and the second segment will have a Q&A to engage with the audience. And also for the Q&A, you can ask questions or provide comments through the Q&A window, which is provided at the bottom of your Zoom screen. Please also keep your comments or questions constructive and professional and concise. Finally, when you have a question or a comment, please add the name of your organization and the country from which you are speaking, just to provide some context. For now, I would like to invite you to watch a video featuring Geminatu. She's a 16-year-old schoolgirl and president of the Child Parliament of Bamako, and she won a poem competition organized last February in Mali. The video is really about the impact of the COVID-19 pandemic on students. So, Mustafa, can you please play the video?
Désespérés se lancent. Les volontés baissent, les apprentissages cessent. Mon avenir 2 mois que les écoles sont vides, que les bancs commencent à porter des rides. Un grand retard s'annonce, un air désespéré se lance. Les volontés baissent, les apprentissages cessent. Mon avenir m'inquiète, mais la paresse a tout dominé. Le courage diminue dans l'assiette, le vide m'a freiné. Mon cahier et mon stylo me fuient. Je me vois noyé dans ce puits. Mon éducation est en danger, mon avenir est menacé. Je suis une élève en détresse, il y a peu de notions qui me restent. La nuit joue sur mon cerveau et pour l'exprimer, je n'ai que ces quelques mots. Mes chers frères et sœurs, l'espoir doit être notre source. Le coronavirus disparaîtra et nous ne devons pas perdre courage, car l'avenir de ce pays réside dans nos bras. On verra bientôt les écoles s'ouvrir. Entre-temps, suivez les cours à distance. Continuons de faire la lecture avant que le coronavirus passe. Révisons nos leçons et faisons des exercices afin de mieux nous adapter à l'ouverture des classes.
Thank you very much, Geminatu, for your inspiration and for that call for children to continue to have access to education during this really uncertain times. Once again, good afternoon and a very warm welcome to our distinguished speakers and to our wonderful audience. We have about 500 people who have registered for the dialogue today. I would like to note that our audience includes children, young people, members of government, the diplomatic corps, UN agencies, and civil society organizations. I'm Doris Mpumu, the director of the AU Liaison and Pan-Africa Office and representative for Save the Children to the African Union. I'm delighted to be your moderator for this virtual dialogue between children and decision makers on the impact of the COVID-19 pandemic on children in Africa. Let me note that this dialogue is taking place the day of the Pan-Africa launch of Save the Children's new policy paper, COVID-19's impact on African children, How to Protect a Generation. That's the title of the policy paper. On Saturday, just last Saturday, the Africa Center for Disease Control reported over 177,000 cases of people who are infected in Africa. Also, they reported 4,900 deaths and over 78,000 recoveries. While these numbers indicate an encouraging slow progression of the pandemic in Africa, they do not tell a story about the impact of the virus on children. So further disaggregated data is required to understand the nature of transmission and specific risk to children. In light of the slow progression of COVID-19 in Africa, it's been widely recognized that the pandemic will probably be more of a socioeconomic crisis before it becomes a health crisis. Similar to other parts of the world, thankfully, children are not the face of the pandemic in Africa, but if we do not take the right protection measures, there is a high risk that they will become the main victims. Indeed, the pandemic threatens children's rights and exposes them to disruption of their education, healthcare, protection, well-being, including vital social interaction with family members, teachers, and friends. For some children, especially the most marginalized, the impact could last a lifetime. The number of children who have been out of school over the past few weeks across the continent is estimated at more than 260 million. This is really staggering, and it is a true illustration of the threat and risk children are facing. So today's dialogue provides us with a unique opportunity to strengthen our understanding of the impact of COVID-19 on children in Africa. During this dialogue, we will also share experiences and good practices with a view to identify the political and programmatic actions that are required to protect our children on our continent. Finally, we will take advantage of this wonderful platform to launch our new policy brief, COVID-19's impact on African children, how to protect a generation at risk. This is the publication, and being told that the publication will be shared widely, at least with this audience, as well as the speakers by tomorrow. So to carry out this dialogue, it's really my pleasure and unique privilege to introduce you to our fantastic panel of champions. First, I would like to introduce to you Prescovia. Prescovia is a 17-year-old student from Zambia. And on this dialogue, she's representing children from Eastern Southern Africa. She's currently preparing for her 12th grade high school exit exam. Prescovia dreams of becoming an environmental engineer because she wants to make a difference in her rural farming community, where climate change has had a profound impact as a result of environmental degradation. Our second speaker is Mariam Ahmed. Mariam is a wonderful 20-year-old youth ambassador for Save the Children International Nigeria. She's a powerful campaigner against child marriage and sexual abuse. She's also an influential advocate for girls' access to education and reproductive rights. Mariam is one of the 10 global youth leaders on nutrition. She produces songs, and if we are lucky, Mariam will perhaps grace us with a song at the end of our dialogue. Our next speaker is Kijala. Kijala Shako is the head of advocacy campaigns, communication, and media for Save the Children East and Southern Africa. She's a strategic thinker, and her career spans 20 years with strong leadership and extensive experience in child rights and youth engagement across Africa. I also have the pleasure of introducing Dr. Joan Nyenyuki. And Dr. Joan Nyenyuki is the new Executive Director for African Child Policy Forum, premier Pan-Africa Center for Policy Advocacy and Dialogue on the African Child Rights. Dr. Nyenyuki has championed human rights, gender justice, and equality in various senior leadership roles in national and international NGOs. She began her career as a medical doctor working with survivors of torture and sexual violence before transitioning into human rights. We are also very fortunate to have two commissioners on at this dialogue. Both of them are trailblazers and movers and shakers at the AU. I will start with Her Excellency Professor Sarah Anyang Agbor. Commissioner Agbor is the Commissioner for Human Resources, Science and Technology. She has over 20 years of experience in the field of academia, and Commissioner Agbor has been a champion in various areas relating to her mandate. We are particularly, and we all should be proud of her leadership in the promotion of the protection of schools from attacks and military use. Our second commissioner, our second trailblazer is Her Excellency Ms. Amira Al-Fadil, Mohammed Al-Fadil. Her Commissioner Al-Fadil is the Commissioner for Social Affairs. Prior to her current role, she served in several leadership roles, including Minister of Welfare and Social Security of the Republic of Sudan, a Minister of Social Affairs for the Khartoum State Government, and Member of Parliament. Commissioner El-Fadil is a child rights champion who is spearheading the Salima initiative to eliminate female genital mutilation and child marriage campaign. Then we have also Mr. Joe Kapembwa, who is the current permanent secretary to the Ministry of Youth, Sport, and Child Development in Zambia. He's also served as permanent secretary under the Ministry of Works and Supply. Last but not least, we have Professor Stanislas Ouaro, who is the Minister of National Education from Burkina Faso. And he's also an associate professor of mathematics and research professor at the University of Ouagadougou. Honorable Ouaro led last week the process of reopening schools after 2 months of closure due to COVID-19 in Burkina Faso. Now you see that we really have a fantastic and incredible panel of speakers for the dialogue today. Again, for those who have joined in late, a very warm welcome to you and to our speakers. This panel is meant to be a dialogue and a conversation between children and decision makers. We will have 2 rounds of questions, and then which will be followed by a Q&A, and each speaker will have 3 minutes. Only 3 minutes. I do understand that the time is limited, and because we have a very large panel. I will ask, in fact, the speakers to, whenever they're speaking, to turn on their mic as well as their video. And once they finish, when they conclude their intervention, just to turn them off. So without any further ado now, I would like to invite our child ambassador to start this conversation. And I would like to turn to you, Prescovia. Prescovia, can you share with us experiences on how children from Eastern Southern Africa have been affected by COVID-19? Prescovia, you have the floor.
Thank you very much, honorable members, your excellencies, dignitaries present, participants joining online, my fellow children, all protocols observed. I'm here today to represent the voices of my fellow children from across East and Southern Africa on how COVID-19 has affected our lives. Last week, some of us met and shared our experiences under the new norm, as it is being called. Our lives have never been the same since the outbreak of COVID-19. Our education, protection, health, and right to participate have been affected. Education. When I think about the impact on education, I remember the words from my newly found friends from Ethiopia and Uganda, who, like many other children in Africa, have not been in a classroom for months now. We cannot learn anymore, and where efforts have been made to help us access education through TV, radio, or internet learning, most of us do not have access to these things. I personally come from a rural district in Zambia where these things does not exist for all the children. Other children, like in Ethiopia, they learn through Telegram, which may take long to be reaching the learners. Protection. We as children face risks to our protection as we stay at home the whole day. As my friend from Uganda said, girls staying at home are getting pregnant and getting married off. Others get physically abused as they are beaten by their parents and guardians now that they are at home. We have become domestic workers and experiencing child labor, but if we go back to school, at least we'll focus on learning. Socially, we are children. We like to play with our friends. But since the coronavirus came along, we cannot play anymore. And when a child gets sick, parents will not be allowed to stay with the children in a hospital. Children are also begging in streets because their parents lost their jobs. Thank you.
Thank you very much, Praskovia, for sharing your experience. Yeah, there are just a few things that you noted, that children cannot play anymore. Not every child has access to online learning. So those are things that we need to keep in mind as we continue this conversation. Thank you again. Now, I would like to turn to Kijala. The policy brief that I mentioned in the opening remark and that we're launching today has been published to fill a gap and amplify the voices of the specific realities of children during this crisis. We did that with a view to enhance the quality of their lives during this unprecedented times. Kijala, you have contributed to the policy brief. Can I ask you to share with us the key findings, building on the experience that Praskovia just shared? Kijala, you have the floor.
Doris, honorable members, excellent presence, participants, children of Africa, all protocols observed. Doris, this report is dedicated to all the children of Africa who have become an invisible group in the COVID-19 crisis with regards to its planning and response, despite being one of the most vulnerable and affected populations. And so this report and policy paper, Doris, has been produced to amplify the voices and specific realities of children during this crisis, in the hope that it will enhance the quality of their lives during these unprecedented times. And so we are inspired by all the powerful and brave child and youth ambassadors like Praskovia and Mariam, who are on those call, who across the continent are raising their concerns to decision makers and sharing information on how COVID-19 is impacting on them and other children. And so it is our hope that this policy paper will not only raise an alarm to decision makers across Africa to do whatever they can to ensure that we protect a generation of children, but that we can also take the opportunity to share some best practices that we have seen across the continent in how to mitigate the impact of COVID-19 on children. Building up on what Praskovia has said, some of the most devastating secondary long-term effects we're seeing on children's rights, well-being and safety are having a much larger disproportionate impact on poor and vulnerable households. And this is likely to impact their lifetime. And so when you look at the goals, when you look at the Sustainable Development Goals, when you look at Agenda 2063, we actually have about 10 years to change the lives of the current generation of children on the continent. And so when you start to look at some of the impacts that have already been referenced to, is we already see an overburdening of the under-resourced Africa health system and a disruption of routine health services. And we see that this is likely to increase the disease incidences and deaths from preventable and treatable diseases, especially for children. So for instance, when you look at some of the projections, we find that malaria deaths might reach 769,000 in Africa, which is the highest seen in the last 20 years, because there's been a disruption of insecticide-treated net campaigns and access to anti-malarial medicines. So we are finding that as member states, as African governments are making all efforts to respond to COVID-19, there's a disruption to some of the routine healthcare. For instance, even vaccinations have been disrupted, and then this has a lot of impact on children in the continent. We're also seeing reports from different countries where health facilities have temporarily closed or suspended the provision of essential health services and are actually turning away patients who are seeking non-COVID related health services as a result of the strain. In some countries, lack of reduction of public transportation and banning multiple people from riding on motorbikes is also limiting access to facility-based care. In the process of developing the policy paper, we also realized that stigma within the society is also preventing citizens from accessing healthcare, and that impacts children even more. In addition to the impact on the healthcare, we're also seeing a lot of strain that has been caused by the closure of schools. We do know that on the continent, a lot of children not only rely on school facilities for education, but also a level of protection and nutritional value. So a lot of children are reliant across the continent on school feeding programs, and these have now been disrupted. On a positive note, we are seeing governments across Africa trying to move from school closures to maintaining learning systems. So in Uganda, for instance, we've been part of distributing home learning packs. In Ethiopia, you can see online learning platforms, radio-based education programming, but we do know that this does not reach all the children, especially the most vulnerable. Another impact of coronavirus on children is that we are seeing it has come to exacerbate existing vulnerabilities. So we're finding children who are already rendered vulnerable by different circumstances are not able to access social protection mechanisms. And so you're finding children living on the streets, children who are migrants, internally displaced, and refugees are not only exposed to higher sanitary risks, they're also facing higher limitations in terms of access to healthcare and an alternative education system. And we do know that children make up 59% of Africa's refugee and asylum seekers and 50% of its internally displaced people. And these have been heavily impacted by the COVID-19. And many across the continent who have been seeking asylum and safety have been found caught in between countries. We have unaccompanied children returned to countries of origin or stuck within transition countries. We're also finding that for many children on the continent, COVID-19 is unfolding against a backdrop of very worrying hunger levels. And these have been created by climate shocks, conflict, and various economic challenges across the continent. So where we already had children with higher nutritional values, children struggling with malnutrition, which then impacts their immunity, we are finding that the COVID-19 has come and is making this a lot worse. So we are finding as many as 107 million children, most of whom are vulnerable for different reasons mentioned previously, are acutely food insecure. And so the consequences of coronavirus are actually adding to a long list of challenges that children on the continent are suffering. So we're seeing many projections show now that food insecure populations could actually double in the coming months, which is a serious nutritional impact for children.
Thank you. Thank you very much, Kijala. Now, I would like to invite Dr. Nyenyuki. Dr. Nyenyuki, I would like to ask you, I know that ACPF has been very active in really analyzing government's responses to COVID-19, and I would like to ask you to share your organization perspective on government's response to COVID-19 in terms of policies, but also in terms of to COVID-19 pandemic. And I would be grateful if you could highlight some good practices that your organization has identified. Thank you. You have the floor, Dr. Nyenyuki.
Thank you, Doris, and good afternoon, everybody, honorable members and your excellencies and my fellow conversationalists. So I will share with you in the brief minutes that I have what our experiences have been and our perspectives, particularly in terms of the existing gaps and a few good practices which we would like to highlight. I'll start by just acknowledging that the African governments have done a lot in responding to the pandemic. They moved quickly, they set up coordination units, they developed the emergency health programs and even mobilized resources. But as we did this, a few gaps began to emerge. And one of them really is the very strong focus on the public health in a way that does not bring in all the other social economic elements and threats that are being faced by children and families and communities, especially the most marginalized. So Kijala mentioned the very strong focus on COVID has meant that a lot of resources have been diverted from the pre-existing health systems, the malarias, TBs, and malnutrition. The other concern that we have seen is really the heavy securitization of the lockdown measures, where police and paramilitaries are out on the streets enforcing lockdown measures. And what does this mean, especially for children who live on the streets, families which live on the streets, and for those which survive on daily wages? We have seen in several countries blanket policies implemented and rolled out across the country with no regard to the particular varying contexts of regions and districts, which really are not homogeneous. We've also seen countries borrowing and not adapting the responses that have been used in Europe. And this really is threatening a lot of families, especially those that live on, close to the poverty line. And in terms of gaps, the one that I would really like to highlight is the gaps in socioeconomic responses. There has been a very strong public health response, but minimal socioeconomic support programs. We already have very little in terms of social protection, social safety nets on the continent, and the few systems that exist are weak and have been stretched. So now we are seeing that there are huge economic gaps that are emerging and are likely to push the millions of households which are already living at the brink of poverty into extreme poverty. Further, we are seeing that a lot of measures are really towards families which have formal incomes. For instance, there are tax reliefs, there are tax reductions and waivers, but how do those trickle down to the ordinary informally employed families? Just to quickly go to a few of the good practices, however, that we have seen and we must acknowledge and celebrate and ask to see more of, is the excellent coordination we've seen within the regional economic communities. We've seen that in SADC, we've seen it in the East African community, where neighboring countries are really coming together, having a coordination unit, and even agreeing on how they're managing movements across the borders, with a lens even of ensuring that there's free movement of people where that needs to happen. That's commendable. We've also seen several countries, actually quite many, which have set up the coordination units, the multi-sectoral coordination units, which are bringing in people, departments from, and actors and skills from different sectors of government, and some of them even bringing in the private sector. This public-private partnership, we have seen it at play, and it has a lot of benefits because it's bringing in new skills, and it's also bringing in African philanthropists to really be able to do more for their societies. And another good practice we have seen, especially for children in conflict with the law, is seeing the criminal justice system responding quickly, reviewing their cases and seeing which are those which can be expedited and where can there be non-custodial sentences and these children returned home to their families so they face less risk in the institutions that prisons are. And we've also seen in some countries the release of mothers who have children, where the mothers were incarcerated with their children. I'm trying to make sure that I do not repeat what has been said by my fellow panelists. So I really don't want to go into some of what is repeated, but Doris, that's what I have for now. Thank you.
Thank you very much, Dr. Nyenyuki. Just 2 points that I wanted to note. The fact that we've had a good health response, but the economic response has not.
Un système de réponse par rapport à la situation du COVID-19, mais malheureusement, nous n'avons pas un système robuste concernant la réponse économique. Je veux maintenant passer la parole à Myriam. Mariam, je crois que vous avez entendu 3 orateurs qui ont partagé leur point de vue par rapport à la réaction du gouvernement, et nous avons entendu parler Save the Children qui nous ont donné un résumé concernant les politiques qu'ils vont lancer aujourd'hui, et vous avez également entendu Priscovia. Donc je vais vous demander, selon votre opinion, comment pensez-vous, selon vous, COVID-19 a touché les familles de l'Afrique centrale et de l'Ouest, et comment également le COVID-19 a affecté les enfants qui vivent dans cette région? Je serais donc ravi que vous puissiez partager votre expérience, surtout vis-à-vis des enfants de l'Afrique de l'Est et de l'Ouest. Mariam, vous avez 3 minutes. Oui, il y a un problème de traduction. Est-ce qu'il y a-t-il un problème de traduction? Est-ce que la traduction est-il disponible vers le français? Est-ce que la traduction est-il disponible vers le français? Alors, quelques secondes, Mariam, je voulais juste vérifier si la traduction vers le français donc passe. Donc, je voulais juste confirmer. Donc, le point suivant, c'est que si vous ne parlez pas, je demande à ce que vous puissiez éteindre votre caméra, que vous éteignez votre caméra, si vous n'avez pas la parole. Donc, ceux qui auront leur caméra allumée seront les orateurs, les personnes que nous allons leur donner l'autorité de parler, et également les interprètes. Bonjour Doris, bonjour Mariam, vous avez la parole. Je disais que l'impact qui a eu par rapport à la scolarisation, nous reconnaissons que beaucoup des écoles ont été fermées à cause du coronavirus. Même les enfants de l'Afrique de l'Est et centrale, le système scolaire a été interrompu, et certaines écoles ont créé des plateformes d'apprentissage pour permettre aux étudiants de continuer à étudier. Mais cependant, la plupart des enfants qui vivent dans des familles pauvres sont exclus. La plupart des écoles publiques n'ont pas les capacités, les ressources, les technologies et les équipements pour fournir des enseignements en ligne. Et 2, vous avez le bien-être et la protection des enfants. Le COVID-19 a ajouté plus de stress au niveau des familles, au niveau des parents, des adultes. Et vous avez des problèmes tels que perte de travail, l'isolation, et également des inquiétudes vis-à-vis de leur situation sanitaire. Donc, puis vous avez également des questions liées à l'abus des enfants. Et vous avez des enfants qui vivent dans les zones de conflit, également dans les camps de réfugiés, sont abusés. Et vous avez par exemple l'exploitation sexuelle, et pour accéder à l'eau ou bien à la nourriture, vous avez également des enfants qui meurent facilement à cause des maladies. Et puis, étant donné que l'introduction de l'enseignement à longue distance, il y a ces enfants donc sont plus exposés à des contenus Internet, et également sont exposés à des prédateurs en ligne. Alors, concernant le niveau des foyers, ou bien plutôt des ménages, nous avons constaté la plupart des ménages, les responsables de ces ménages ont perdu leurs travaux, et donc ils n'ont plus accès à, par exemple, aux médicaments, ils n'ont plus l'accès à la nourriture, l'accès à l'eau potable. Et ces enfants, donc, en conséquence, sont mal nourris et meurent des maladies préventables. Et mon tout dernier point, c'est sur la santé mentale. La santé mentale est très, très importante concernant la vie des enfants et même les parents. En parlant des enfants, et à cause du virus corona et également à cause des changements que ces enfants sont en train de subir. Ces enfants, donc, sont abusés à la maison et donc à cause des scolarisations, ils sont donc à la maison abusés et soumis à plusieurs autres enjeux. Merci pour avoir partagé votre expérience. Juste un autre point que je voudrais souligner par rapport à votre présentation, je suis ravi que vous avez parlé sur la santé mentale. Je crois que ça, c'est quelque chose qui est prioritaire. J'espère que les États membres et les bailleurs de fonds vont également donc mettre l'accent sur ces éléments durant cette période de pandémie. Maintenant, je veux inviter son Excellence commissionnaire Arbor et qui est très active au niveau de l'Union africaine et qui est également chargée d'unir plusieurs parties prenantes et elle est chargée du secteur éducatif par rapport à l'impact du COVID-19 dans les secteurs de l'éducation. Commissaire Arbo, est-ce que pouvez-vous nous donner quelques exemples, un ou deux exemples concernant les actions clés que l'Union africaine a adoptées pour aborder cette question du COVID-19? Merci pour avoir participé à cette réunion. Je crois que, Madame la commissionnaire, nous ne vous entendons pas. Nous ne vous écoutons pas. C'est comme si votre micro est éteint. Madame la commissionnaire, allumez votre micro.
That we did from the policy paper brief that Save the Children has published and we're launching.
Ou bien plutôt les présentations qui ont été faites par Save the Children concernant.
Provide your perspective on two recommendations pertaining to your mandate.
Thank you very much, Doris, for organizing this meeting, and thank you to Save the Children. Thank you also for developing the policy paper on the impact of COVID-19 on children.
Qui ont été élaborés pour le bien-être des enfants. Également, ma sœur commissionnaire, Steve Sarah, qui vient juste de joindre cette réunion, et également tous les participants. J'ai vu également, il y a certains ministres. Comme vous l'avez dit, mon département est mandaté donc à traiter les questions sanitaires en Afrique. Et nous travaillons également avec le Centre de contrôle des maladies. Donc nous sommes dans ce combat. Et notre expérience par rapport au COVID-19, c'est que dès le départ, l'Afrique, ou bien l'Union africaine a été alertée. Et souvenez-vous, nous, le premier mois, on n'était pas du tout affectés, ou bien infectés plutôt. Donc, on était plus touchés le deuxième mois. Donc, cette fois-ci, ceci plutôt nous a permis de nous préparer. Et je crois que ça, c'est l'un des éléments et l'une des opportunités qui nous a permis donc de contrôler la situation. Nous essayons de faire de notre mieux pour atténuer la situation au niveau de notre continent. Nous avons agi donc à l'heure qu'il fallait. Puis également, nous avons élaboré des réunions avec les différents ministres de la santé. Et puis nous avons également élaboré des stratégies concernant le COVID-19. Donc, dès le départ, l'Union africaine donc, a pris cette question du COVID-19 d'une manière très sérieuse et puis nous avons agi rapidement et nous avons pris nos responsabilités. Les chefs d'État donc, ont pris des décisions lors de la réunion de l'Afrique du Sud. Ils se sont décidés que l'Afrique, nous allons agir d'une manière collective. Et nous allons le faire d'une manière unie pour combattre ce COVID-19. Le mandat, c'est donc c'est de travailler d'une manière unie. Et je voudrais dire que la vision est claire. Nous avons une stratégie et le mécanisme également est très clair. L'Afrique CDC a un organe technique qui est chargé à la lutte du COVID-19 et cette institution travaille avec tous les États membres. Nous avons également un bon partenariat avec eux et nous avons également impliqué le secteur privé africain, y compris les organisations de la société civile. Donc, ce combat est dirigé par notre organe en collaboration avec la société civile et également avec le secteur privé en Afrique et avec les partenaires provenant de la région et également du niveau mondial. Comme je l'ai dit tout à l'heure, avant de passer à la question de l'impact du COVID-19, l'Afrique CDC est en train d'élaborer des données. Nous avons donc un système de reportage que nous faisons journalièrement. Et aujourd'hui, le nombre de cas en Afrique est une affaire de presque 200 000 cas. Et il est prévu que ces chiffres puissent augmenter et également les cas de décès augmenteront. Mais nous ne perdons pas espoir. Nous n'avons pas encore donc perdu l'espoir en tant que continent africain et également par rapport à nos capacités. Et pourquoi l'engagement technique que nous considérons surtout au niveau continental, régional et au niveau national démontre que l'Afrique a l'opportunité de minimiser le nombre de transmissions et l'Afrique a l'opportunité également et également le continent le moins affecté par rapport au COVID-19. Donc, ces données ne sont pas des données classifiées. Non, si vous me posez la question concernant le nombre des enfants qui sont affectés concernant le COVID-19, je peux vous donner ces informations, mais pas du tout d'une manière assez claire, parce que ces données ne sont pas désagrégées. Alors, c'est la raison pour laquelle nous avons besoin des données désagrégées, ventilées, avoir une idée sur le nombre de femmes qui sont donc affectées par le COVID-19, le nombre des enfants. Nous savons que ceux qui sont âgés de plus de 60 ans sont plus exposés, mais je crois que les statistiques que nous recevons des États membres ne sont pas des statistiques ventilées. Nous leur demandons de publier des données agrégées et ces statistiques nous permettra donc d'agir comme il le faut, d'une manière holistique. Donc, ça, ce sont les défis. Et vous, en tant qu'organisation, en tant que UNICEF, le gouvernement et l'Union africaine, vous devez aborder cette question le plus tôt que possible, c'est-à-dire le manque de données désagrégées. Le deuxième point que je voudrais mentionner, c'est l'impact direct du COVID-19 vis-à-vis des enfants. Ce n'est pas que s'ils sont infectés ou pas, mais l'impact vis-à-vis des enfants affecte donc les droits de base des enfants. Donc, le droit, par exemple, à la protection du droit au développement. Tous ces droits sont affectés plutôt par le COVID-19. Donc, il y a également des problèmes économiques au niveau des pays, au niveau des ménages. Nous avons des parents qui ont perdu leur leur travail. Et donc,
no schools. Those children who used to go to school and to have a meal at the school, they have no opportunity now to have this meal at the school because they cannot go to the school. Schooling is done online from home. The mothers and fathers, they are at the risk of losing their jobs, especially those who are working in the informal sector. So there is a shortage of food. There is problems with food security. There is problems of nutrition. The routine programs that we used to do, the immunizations and the vaccinations, the routine programs of fighting other diseases, all this is being interrupted now by COVID-19 because we have all countries, they have in our member states, it became even a bigger challenge. The children are affected by COVID-19, not only as victims of the virus directly, but also because of the other consequences of COVID-19, because they are losing other their rights, even for the primary health care. There is a challenge now. Accessing health services, it is a challenge. Even when we asked member states to put measures, washing hands, wearing a mask, staying at home, observing social distance or physical distance. When you come to the rural areas, when you come to the areas where people, they have no electricity, they have no running clean water, they have no sanitation systems, and you ask them to put measures, they cannot put it because they don't have clean water. They don't have soap to wash their hands as often as we require. So I think COVID-19 has impacted our children in Africa, but we cannot answer the question of how big, how much they have been impacted by this COVID-19. These are my preliminary remarks, Dorothy, but I will be with you if I need to comment on other areas of this issue. We are doing our best as African Union Commission under the leadership of our chairperson, Moussa Faki, with the support of all the other departments, Commissioner Sarah, Commissioner Josefa, all of the other departments, they are working with us. It's not only social affairs who's leading this fight, but we are leading it also in coordination with the rest of the departments of the African Union. Our ASRIWAC is also on top of the issue, our Child Rights Experts Committee. The secretariat here hosted at my department, they are also working on this issue. They are convening meetings, they are putting guidelines to member states to make sure that children's rights will be protected among COVID-19. And I saw it mentioned in your documents. I thank you for that. But we will be looking to the outcomes of this conversation. We'll see what we can do together. Thank you very much, Dorothy.
Now I would like to go back to Her Excellency Commissioner Sarah Adbor.
Je m'excuse. J'ai constaté que nous ne sommes pas à mesure de vous écouter. Alors, je vais donner la parole pour les intérêts du temps. Je vais donc passer la parole à la personne suivante et je vous donnerai la parole après. Et maintenant, je voudrais faire appel aux représentants du gouvernement. Je veux commencer tout d'abord avec le secrétaire permanent, Kapemwa. Pouvez-vous nous dire, parce que nous savons par exemple que plus de 4,5 millions d'enfants aujourd'hui sont déscolarisés à cause du COVID-19. Pouvez-vous partager avec nous quelles sont les solutions pratiques en termes budgétaires et donc qu'est-ce que nous pouvons apprendre de l'expérience de la Zambie? Secrétaire permanent de la Zambie, vous avez la parole. Bonjour. Je m'appelle Nicolas Banda, je représente le secrétaire permanent, M. Kabomwa, qui est chargé donc du ministère de développement de l'enfant. Nos écoles ont été fermées à cause du COVID-19 parce que dès que nous avons commencé à enregistrer les premiers cas, le ministère de l'éducation, le ministre de l'Éducation, donc, avait pris la décision de fermer les écoles. Pourquoi? Parce que nous avons voulu nous assurer à ce que les enfants ne soient pas victimes, que les enfants ne soient pas victimes de ce COVID-19. Alors, ce que nous avons fait, nous sommes maintenant au deuxième semestre. Ce que nous avons fait, nous voulons donc relancer la réouverture des écoles. Donc, nous devons tout d'abord ouvrir les classes qui doivent, par exemple, les classes qui doivent faire leurs examens de la dernière année. Donc, nous travaillons avec le gouvernement, avec les différentes plateformes de médias du gouvernement. Nous avons également un canal qui est dédié à l'enseignement aux enfants. Et le point suivant, c'est que nous avons ajouté d'autres prestataires de services qui ont intervenu pour soutenir le gouvernement. Et ici, je voudrais parler de l'accès à l'apprentissage électronique. Plusieurs sociétés ont également pu assister le gouvernement à l'achat des unités. Ici, je parle de l'Internet, d'une unité Internet pour permettre donc, à ce que les enfants et les parents puissent accéder à ces plateformes. Nous sommes également au courant qu'à travers le ministère de l'Éducation, nous avons une librairie mobile. Et durant cette période de COVID-19, nous sommes en train de... On ne l'entend plus. On ne l'entend plus.
Je pense qu'on a perdu la connexion avec le directeur, Madame Amouila. Mustafa.
No, yes, you're back on now. Please proceed.
Okay. Yeah, so I was saying that one of the things that we've actually accelerated is the use of, mobile library. But in terms of education, we've started with, gradually, we've started.
Nous avons commencé progressivement. Nous avons commencé avec les classes qui ont des examens en finale et on a eu une approche coordonnée en tant que pays. On a mis en place une cellule qu'on appelle la cellule de gestion des catastrophes qui est responsable de la coordination de toutes les activités pour que le pays puisse faire une réponse à la pandémie. Donc, on a distribué les masques faciaux aux écoles et aussi les agents d'assainissement, on a distribué ça aussi. On a commencé avec quelques classes. Et après, on pourrait voir si nous pouvons ouvrir le reste du secteur de l'éducation. Bien sûr, on a eu quelques problèmes par rapport à quelques questions de logistique. C'est-à-dire distribuer les matériels à temps. On a eu ce problème-là, mais nous avons trouvé des solutions à ce problème-là. Les gens qui étaient censés recevoir les masques faciaux et les substances d'assainissement, ainsi que le point d'eau, on a demandé aux écoles d'utiliser leurs subventions en attendant donc l'intervention gouvernementale. Nous vous écoutons. Est-ce que vous pouvez résumer en 30 secondes? Bon, en 30 secondes, l'autre point que nous avons considéré, nous, en tant que pays, nous avons considéré les groupes vulnérables. Donc, nous ciblons par exemple les enfants qui habitent dans les rues. Et on a impliqué le ministère de la Santé et nous avons aussi impliqué le secteur privé pour participer à cet égard. Merci beaucoup de votre présentation, monsieur, et pour les leçons que vous avez partagées avec nous. Nous sommes heureux de constater que certains enfants peuvent quand même passer leurs examens. Nous voulons présenter une excuse. Initialement, l'honorable Emmanuel Moulenga, qui est ministre du Sport et du Développement de l'Enfant, était censé nous rejoindre, mais il a eu d'autres. Alors, Madame la Commissaire, vous pouvez prendre la parole. Merci beaucoup, Thérèse. Voilà donc les défis technologiques. Voilà les défis technologiques. Je voudrais féliciter tous les intervenants précédents, surtout les jeunes gens qui ont parlé.
The ministers present, all the esteemed participants, and my sister, Her Excellency, Commissioner Amira. Since 11 March 2020, when the World Health Organization declared the COVID-19 pandemic, like you rightly said, and like the Commissioner has stated, because her department, the Department of Social Affairs, has been on the forefront of responding to the health impediments of COVID-19 through the African Union.
Un rôle important à travers le CDC africain.
The spread in Africa. This has called on drastic measures, including closure of schools, universities, and training institutions. While this is important in mitigating the spread of COVID-19, prolonged closures have negative consequences for students, especially the deprived and vulnerable. The first person who spoke on this program mentioned how they've been off school for days. The same thing when Miriam and Priscovia were speaking, they spoke about the challenges of remote learning. And the African Union Commission organized the virtual extraordinary session of the Specialized Technical Committee on Education, Science, and Technology, which you, Doris, participated on 30th April 2020 to address the impact of the pandemic on education, science, and technology. So the key recommendations that the ministers came up with regarding education, one, was that they urged member states to take advantage of the opportunity for online teaching and learning to ensure continuity of education on the continent. But what happens to those in the rural areas where there is no connectivity, etc.? It was important that the governments have to put in improved education systems and robust learning, e-learning infrastructure to ensure quality and integrating lessons learned and good practices from COVID-19 response as espoused by the minimal approach that we gave, which we say connecting the dots, that is the DOTSS approach, and conceiving a model roadmap for post-COVID-19, which integrates continuity of education in the different regional and national responses. Governments have to build infrastructure like solar systems to facilitate connectivity in rural areas, as well as use radio communication to teach their students. It was agreed to plan for reopening schools with appropriate strategies to catch up on lost period of learning by identifying time periods for catching up on work and implement back to school campaigns and measures to curb further infections in educational institutions, including schools, universities, and colleges. Hence, the ministers of education were asked to closely work with the ministries of finance to safeguard the education sector funding, including establishing a contingency fund for education in emergencies. The third thing they agreed upon was to document the impact of school closures on children, girls, disabled persons, and vulnerable populations, including those living in vulnerable conditions such as refugees, migrants, IDPs, and asylum seekers. I believe this virtual meeting today will help us in compiling data. So member states were also urged to document good practices and monitor learning engagement with support from their local and international partners like you, and with the view of sharing information with the African Union Commission to facilitate inter-country learning and upscaling of good practices. We have also organized a series of webinars like you are doing, Doris, under the COVID-19 conversations aimed at facilitating an exchange of information, experiences, and good practices in response to COVID-19 among member states and UN agencies. This includes the opportunities for learning webinar, which held on the 7th of May, 2020. And then to ensure the implementation of the decision of the ministers to ensure that learning continues, the African Union Commission, in partnership with HP, is offering a free of charge online learning platform and technical support, which has already received interest from 6 member states, and engagements are ongoing to enable deployment. It is very, very essential because the COVID-19 pandemic has created circumstances where children, especially girls, like we have the testimonies, how many have been abused, how many have been raped, and how many have been taken into early marriages because of the closure. So girls are the more vulnerable to abuse, neglect, and exploitation. So there are reports of increased rates of child marriage and recruitment of children and soldiers on the continent that can be directly attributed to the COVID-19 outbreak. So that is what we have for education, because education is a sanctuary for learning. Like I think it was Priscovia who said it, and Miriam, that when they go to school, they are safeguarded, they are in a safety net. But without that sanctuary of learning where young minds can feel safe to inquire, explore, reflect, yearn, and develop to their fullest potential, then definitely the Africa we want by 2063 will not be achieved. Thank you, Doris.
And a key recommendation on how do we ensure that children continue to learn during this really critical time. And I also would like to note the call for education ministers and finance ministers to work together to continue to secure and ensure that there is funding for children, for education, for the education sector, especially in emergencies. Thank you again, Your Excellency. Now, I would like to invite Honorable Waro, Minister of National Education from Burkina Faso. Honorable Waro, au Burkina Faso, vous avez conduit le processus de reprise des cours après la fermeture des classes à cause du COVID-19.
Reopening schools because of the COVID-19.
La gestion de la question de l'éducation.
Alors, bonjour Doris, bonjour à tous les participants et un bonjour spécial à També, à la commissaire També que j'ai rencontré l'année dernière lors de la 4e journée de l'alimentation scolaire à Abidjan et que nous avons beaucoup travaillé. Donc merci à Save the Children qui nous donne l'opportunité de partager nos expériences et d'améliorer davantage donc, nos réponses en lien avec donc, cette pandémie qui affecte le système éducatif. Alors, au niveau du Burkina Faso, il faut dire que nous faisons face depuis 2016 à un premier défi, c'est le défi sécuritaire. Nous avons donc des bandes terroristes organisées dans la région sahélienne qui sabotent et perturbent donc notre système éducatif. Et à la date donc du 16 mars 2020, date de fermeture de l'ensemble des établissements scolaires au Burkina Faso, nous avions donc 2512 établissements fermés, pas pour les raisons liées à la pandémie du coronavirus, mais pour des raisons liées à l'insécurité. Et donc, ça affectait autour de 330 000 élèves. Et donc là, c'est un défi que nous travaillons à surmonter. Et nous travaillons avec donc, les autorités militaires, les autorités religieuses et toutes les personnes donc, de bonne volonté. Et chaque fois que c'est possible, chaque fois que les zones sont pacifiées, nous rouvrons les écoles. Et donc, ça, c'est un premier défi. Et pour résoudre ces défis aussi, nous avions décidé d'utiliser tous les supports de communication, donc la radio, la télévision, Internet, les polycopes et tout, pour permettre donc aux enfants de se maintenir donc dans le lien avec le système éducatif en attendant que donc des jours meilleurs se présentent afin que nous puissions donc réouvrir les écoles de façon à leur permettre d'être physiquement sur place. Et donc le 9 mars dernier, donc les premiers cas de personnes donc déclarées positives à la maladie du coronavirus ont été donc constatés au Burkina Faso. Et une semaine après, nous étions obligés, au regard de la progression de la maladie, de fermer toutes les écoles. Et donc, un deuxième défi s'est présenté, donc c'est le défi sanitaire. Et donc, à partir de ce moment, donc, nous avons commencé à réfléchir à comment rouvrir les établissements afin de permettre aux élèves de reprendre leurs activités. C'est ainsi que nous avons mis en place donc, un plan de riposte sur 2 volets. Le premier volet, c'est le volet des technologies de l'information et de la communication pour l'enseignement, que nous avions entamé dans le cadre donc du défi sécuritaire. Et le deuxième volet, c'est la réouverture des établissements pour permettre aux élèves de reprendre. Et donc, nous avons donc le plan de riposte qui a été adopté par le Conseil des ministres, donc le 16 avril 2020. Et à la suite de cela, nous avons décidé justement dans le cadre de ce plan de riposte pour la reprise des activités de doter chaque élève de masques, donc de protection réutilisables et lavables, faits en coton, avec la cotonnade du Burkina Faso. Ça a aussi un impact sur les communautés, dans la mesure où ce sont nos femmes dont les enfants sont à l'école qui tissent donc les pagnes avec le coton et donc ils les remettent donc au tailleur pour la couture. Et donc nous avons embarqué autour de 20 000 familles donc, dans ce processus de confection des masques. Et ça leur permet aussi d'avoir des ressources donc, de l'État pour pouvoir faire face donc, à ce choc financier lié à la maladie du coronavirus et permettre à leurs enfants de repartir à l'école. Et au regard de l'évolution de la situation, nous avons aussi mis à disposition des établissements du savon pour le lavage systématique des mains et appelé la communauté à contribuer à mettre à disposition des dispositifs de lavage des mains là où il n'y en a pas et à approvisionner en eau là où il n'y en a pas de façon à permettre aux élèves de pouvoir se laver les mains à la reprise, qui est une mesure barrière importante. Et nous avons conçu un cours de sensibilisation à la maladie que nous avons imprimé en 150 000 exemplaires et partagé à l'ensemble des enseignants du Burkina Faso. Et nous avons aussi élaboré des affiches avec l'accompagnement de partenaires, l'UNICEF en particulier, que nous avons affichées dans chaque salle de classe du Burkina Faso et tiré en 120 000 exemplaires. Et à l'issue de cela, nous avons évalué donc l'état d'exécution des activités pédagogiques et nous avons à notre niveau des normes qui disent que lorsque nous arrivons à effectuer 70% des cours, nous pouvons valider une année. Et comme on l'a fait, nous avons décidé de valider l'année, parce que nous avons fait les 2 trimestres, de valider l'année pour l'ensemble des élèves en classe intermédiaire et pour les classes d'examen, de les ramener pour qu'ils puissent suivre le cursus jusqu'à la fin, afin de passer les examens, donc qui commencent dès la semaine prochaine pour le sport et qui vont se terminer donc en fin août prochain. Et nous avons reprogrammé la rentrée pour faire en sorte que les enfants puissent revenir parce qu'ils sont à 2 mois et demi d'arrêt pour les autres. Donc, de leur permettre de revenir pour reprendre les cours assez rapidement pour la nouvelle année scolaire. Et donc la rentrée scolaire est fixée pour les enseignants. La nouvelle rentrée 2020-2021 au 15 septembre prochain. Et le 1er octobre, les cours reprennent pour tout le monde. Donc voilà un peu donc des initiatives que nous avons prises pour faire face donc à cette situation. Et aujourd'hui, nous avons profité de la pandémie du coronavirus pour accélérer le processus donc de cours à la radio, cours à la télévision, à Internet et tout. Et nous sommes bien avancés actuellement. Les cours passent donc dans les canaux de radio, de télévision et sur notre site Internet pour l'ensemble des élèves des classes d'examen. Et donc même ceux qui sont dans des zones où la fermeture elle est occasionnée par donc, les menaces terroristes, ils ont la possibilité de suivre ces cours-là et de pouvoir prendre part aux examens en temps venu. Donc voilà, présenté assez rapidement donc, ce que nous faisons ici pour sauver notre système éducatif qui compte, on va dire, autour de 5 millions d'élèves. Et pour les examens, c'est autour de 850 000 élèves qui sont concernés et qui prendront part aux différents examens et qui prendront fin en fin août.
Merci infiniment, Monsieur le ministre, pour cet apport. Oui, le défi sécuritaire est une chose, hein, et récemment, d'ailleurs, le Conseil de paix et sécurité a tenu une réunion pour recueillir les témoignages non seulement de la société civile, mais aussi des États membres pour voir de quelle manière le Conseil de paix et sécurité de l'Union africaine peut faire face à ces questions et faire en sorte que les enfants continuent d'apprendre même dans les zones où la sécurité n'est pas garantie. Et j'aimerais aussi vous féliciter, nous aimerions vous féliciter pour tous les efforts que vous avez déployés pour protéger les enfants et assurer leur retour à l'école. Je voulais en fait, j'ai d'autres questions à vous poser parce que nous voudrions apprendre de votre expérience, donc comprendre un petit peu quelles sont les leçons apprises et quelles sont les bonnes pratiques et les conseils que vous pouvez donner à d'autres pays qui se préparent à reprendre les cours. Je vous donne 2 minutes, s'il vous plaît.
Ok. Alors, merci, bien reçu. En fait, pour les bonnes pratiques, c'est l'utilisation des technologies de l'information et de la communication, la radio, la télévision, Internet, tous les supports de communication pour permettre aux élèves qui sont en rupture scolaire de pouvoir se maintenir dans le système éducatif de façon à ce qu'à la reprise, ils aient un niveau qui leur permet d'aller un peu plus vite. Et donc, moi, j'encourage cela fortement et c'est tout à fait possible. Il faut y aller beaucoup, y vont. Et on pourrait partager donc tous ces contenus qui sont gratuits à d'autres pays de façon à permettre aux enfants de pouvoir y suivre les cours et participer. Le deuxième volet important, c'est la question donc de l'alimentation scolaire. Et la commissaire També se souvient qu'à Abidjan, lorsque nous avons participé à la quatrième session de l'alimentation scolaire au niveau africain, donc le Burkina Faso est le pays qui met le plus de ressources dans l'alimentation scolaire. Nous sommes à un peu plus de 40 millions de dollars par an que nous mettons à disposition donc des communes pour l'acquisition des vivres pour les enfants parce que la bonne alimentation scolaire est facteur de réussite. Et aujourd'hui, ces ressources sont là, beaucoup ont acquis des vivres, les enfants de certaines classes ne reviennent plus et d'autres sont dans des zones à défi sécuritaire. Alors, ce que nous autorisons donc à ces mères qui ont acquis les vivres pour les enfants, c'est de leur permettre de les avoir, mais sous forme de rations sèches. Donc, on leur partage donc les vivres aux différentes familles qui ont des élèves donc qui ne partent plus à l'école parce que l'année est terminée ou parce qu'ils sont dans des zones à défi sécuritaire. Dans des sites de déplacés aussi, nous les partageons aux familles des enfants de façon à ce que ces enfants puissent avoir à manger en attendant la reprise. Et donc, ce sont ces deux volets. Moi, je pense qu'il faut insister sur la question des technologies de l'information et de la communication pour l'enseignement et la question de l'alimentation scolaire. Il faut continuer de faire des efforts en mettant à disposition des enfants qui ne repartent plus à l'école pendant une certaine période, donc des rations sèches, leur permettant donc de pouvoir s'alimenter et leur famille en attendant donc la reprise.
Merci encore, Monsieur le ministre. Et j'aimerais repartir et parler à Monsieur Kapemba, le Permanent Secretary. I would like to come back to you, sir, and I would like to know what opportunities that the pandemic provided to accelerate the gains for children and young people in Zambia and Africa as a whole.
Thank you very much. I think for us, we see a lot of opportunities. One of it is, for instance, if you talk about issues of water and sanitation, we feel that this will be a very good opportunity. Right now, if you talk about issues of hygiene, this is something that we've been doing for a long time now. But I think the coming of COVID has also created that awareness, and we feel that this is one platform that we can build, move on, and also entice other people to come on board. But also, I think in terms of coordination, I think it has shown that when you work in a manner that we've worked in terms of the things that we are doing. We hope that this can be something that can be accelerated moving forward, that we can build on this and bring all the stakeholders together, so that it's not just something that we do in the time of crisis, but this is it will be like a way of doing things, especially when you want to address needs of children, given the diverse nature and manner of rights of children and their needs.
Thank you. And I would actually like to seek your indulgence to take an additional 20 minutes after 4:30, and we're planning on ending at 4:30. But if we can take an additional 20 minutes to make up for the technical issues that we had, that would be really appreciated. So now, very quickly, I would like to ask all the speakers to make 2 key recommendations before we move on to the Q&A. Kijala, can I start with you? Just 2 or 3 key recommendations, and then I will ask Dr. Nyanyuki to do the same. And after Dr. Nyanyuki, I will ask Prescovia and Mariam to do the same. Kijala, you have 2 minutes.
Thank you, Doris. I have 4 recommendations. The first is a request to member states to ensure that we preserve children's rights during COVID-19 through guaranteeing access to quality healthcare, education, protective services, and other rights as set out in the Africa Charter on the Rights and Welfare of the Child, as well as the UN Convention on the Rights of the Child, especially as they are enshrined at the national level. And then the second one is to ensure that every response plan is driven by the best interests of the child and they do not harm principles, so that we have child-centered response plans and contingency plans across the continent as we respond to COVID-19. The third is around recognizing and integrating response plans that take into account the specific needs of the most vulnerable. This includes girls, children on the move, children with disability, and children who are disenfranchised in different ways at the continental, the regional, and the national level in terms of response plans. And finally, Excellencies, ensuring that we are responding to the long-term needs of children through development and implementation of holistic social protection mechanisms and policies so that we are able to protect children and their families from any future shocks. Thank you, Doris.
Dr. Nyanyuki, can I ask you for your 2 recommendations?
Thank you, Doris. And I have 3 recommendations, and Kijala has very graciously touched on one, on the element of the best interests of the child. So I'll go right into my second and third recommendation. And my second recommendation is on social protection policies and the role of an integrated multi-sectoral response that brings together health, education, child protection, financial relief, food assistance, among others. And this is really learning from what we've seen with HIV and the Ebola responses, where it is important that with the heavy strain on systems and resources that we have, that social protection remains high on the agenda, and that social protection reinforces an integrated child protection system during this crisis, but in a model that is sustainable beyond. My second recommendation is in terms of financing of the policies and the programs that are in place. And here I have 2 sub-recommendations. And the first is that in increasing the funding towards mitigating the COVID pandemic, governments must be very careful to not reduce the funds that are available for other health programs, including mental health programs. And the second element of financing is that now would be really a good time for countries to stop and review where are they in terms of living up to their commitment of their Abuja Declaration, and to accelerate efforts towards living up to the commitments of having 15% of the annual government spending going to health. Thank you, Doris.
Thank you very much, Joan. Can I invite Prescovia or Mariam to make their recommendations? Prescovia, we'll start with you.
Thank you very much. Our demands to governments in Africa. We know all children have the right to access to education. We ask for governments to spend more money to make sure that we can continue learning while staying at home, by providing radios, TVs, and internet learning. They must make sure that children in rural areas and from poor families get to learn. We want to see mobile libraries passing in our communities, delivering books for us to learn. We want to see, and for our friends in examination classes who have started going back to school, governments must make sure that they provide water and soap, hand sanitizers, and face masks so they can be safe. We are also worried about our health. The governments must create awareness to children on the impact of COVID-19 and how it can affect children and their families. They also must build more health centers in the villages where we can go to for the health problems. Governments must also provide enough soap, water, and protective personal equipment that are made to suit children in the villages. The government must...
Personnel. Le gouvernement doit s'y assurer à ce que les enfants soient protégés contre le COVID-19. Nous avons le droit d'être protégés en tant qu'enfants durant cette période de COVID-19. Le gouvernement doit s'y assurer à ce que aucune mauvaise pratique soit perpétrée auprès des enfants, ou bien que les enfants soient... Alors, le gouvernement doit prendre des mesures efficaces pour protéger les enfants contre les différents abus, tels que mon nouveau ami du Malawi a demandé à ce que les enfants puissent intervenir dans les différentes réunions, et le gouvernement doit soutenir les familles pauvres et doit également fournir la nourriture à ceux qui ont perdu leurs emplois, et prendre également soin des enfants qui vivent dans les rues et prendre soin de leurs parents afin qu'ils soient en mesure de nourrir leurs enfants. Et le tout dernier point, c'est ce que je voudrais dire, c'est que ce sont plutôt les éléments que nous voudrions voir. Merci. J'ai dû vous interrompre à cause du temps, et merci beaucoup parce que vos recommandations ont été très claires, et j'espère que les États membres ont pris note et seront à mesure d'agir. Maintenant, je veux demander à Mariam. Mariam, je demande à ce que vous soyez très brève par rapport aux recommandations, et puis par après, je vais donner la parole aux deux commissionnaires. Donc, brièvement, les gouvernements africains doivent prioriser les efforts dans le secteur.
Available resources to expand awareness campaigns, hotlines, and other services for children at risk of violence in the home or online sexual exploitation. And then my last point is for the African governments to ensure that child-centered services, including nutrition programs, immunization, maternal and newborn care, mental and psychosocial health services, and community-based child protection programs continue to function. Thank you.
Thank you very much. Excellent to you, to the point and to the time. In fact, I would like to actually to go directly now to the Q&A. I'm mindful of the time. And then I will ask the two commissioners, Excellency Commissioner Agbor and Her Excellency Commissioner Amira Al-Fadil, to make their recommendations as they provide their concluding remarks. I hope that's okay with you, and I apologize in advance for the inconvenience. So now there are two questions that have come through the Q&A box, and the first one is about really the person who's asking the question, we don't know, the person did not identify themselves, but so the question is, the COVID had a very considerable and multifaceted impact on lives of children in general and school children in particular. Most of the children come from poor families. Very concretely, what support measures have been taken to help poor parents meet the primary needs of children: food, clothing, further learning with the closure of schools? So that's the first question. So what kind of support is being provided to poor families? And I would like actually to ask perhaps Minister Waro to take on that question. Then the second question is people, especially children in refugee camps and displacement camps, lack information related to the COVID outbreak. They're not practicing social distancing, and this puts them at risk. Save the Children intervening in such settings is Save the Children intervening in such settings. So this question will go to Kijala. And then the third question is children affected by armed conflict again. What is the strategy of the African Union concerning the question of education in post-conflict zone of the Sahel in the context of COVID-19? Très concrètement, Monsieur le Ministre, quel type d'aide est mise à la disposition des familles pauvres qui sont affectées par le Covid? Vous avez 2 minutes.
Merci Doris, merci à tout le monde. Donc effectivement, pour les familles déshéritées, ce que nous faisons avec l'appui des partenaires, c'est que déjà on a l'ISESCO qui nous a remis des ressources autour de $40 000 et nous avons acquis des postes téléviseurs, nous avons acquis des radios, des smartphones que nous allons partager donc à des familles déshéritées, à des familles déplacées internes liées à l'insécurité pour permettre aux enfants de ces familles de pouvoir suivre les cours que nous mettons à disposition par la radio, par la télévision et sur Internet. Et nous avons aussi, dans le cadre donc d'une requête, de requêtes formulées donc aussi bien à la Banque mondiale qu'au Partenariat mondial pour l'éducation, en lien avec l'éducation en situation d'urgence. Donc nous avons à ce niveau de grandes lignes pour l'acquisition donc de ce matériel à mettre à disposition, mais aussi l'acquisition de vivres pour mettre à disposition donc de ces familles pauvres-là. Mais déjà, comme je l'avais dit tantôt, les vivres déjà acquis dans le cadre donc de cantines scolaires, les maires nous adressent déjà, je suis déjà à une dizaine donc de demandes que j'ai accordées, qui permet donc à ces maires-là de partager aux enfants des familles déshéritées les vivres qui ont été acquis dans le cadre de la cantine scolaire. Donc, ce sont des initiatives comme ça, à côté de la reprise physique, qui permettent donc à ces familles-là déshéritées, dont les enfants ne vont pas à l'école à cause du Covid, mais aussi à cause du défi sécuritaire, de pouvoir donc se maintenir dans le lien du système éducatif en attendant donc une reprise des activités physiques de leurs enfants.
Merci beaucoup, Monsieur le Ministre. Kijala, can you please take the second question? So what kind of people are, and especially children in refugee camps and displacement, lack information and related to COVID-19 outbreak? They are not practicing social distancing, and this, what is Save the Children doing?
Thanks, Doris. As Save the Children, we're intervening in a couple of countries across the continent, and we're intervening in different ways through supporting governments in provision of health services, but also through the dissemination of information around prevention and care for COVID-19, and then also sharing information packs and education packs to children in refugee settings and children on the move. And then we are also advocating with governments to ensure the protection of the rights of children on the move in different ways across the different regions on the continent.
Thank you, Kijala. Then the third question is actually, if I can ask Commissioner Agbor, what is the strategy of the African Union concerning the question of education in post-conflict zone of the Sahel in the context of COVID-19? I think we had some elements of response from Burkina Faso, the Minister of Burkina Faso, but here they're asking for what is the AU strategy. Commissioner, if you can respond in 2 minutes, that would be appreciated.
Okay,
yes,
thank you very much.
Absolutely.
The Minister of Burkina Faso, I met him when he was Minister of Youth, and again I'm meeting him now, and that is how government should be, fully from one to other, has responded to that question, because the ministers of education, when they met at the extraordinary meeting that we held, insisted that we need to talk about social or humanitarian efforts that we will take to the refugee camps and for those in migration, etc. So I think that the response that the Minister of Burkina Faso have given is very, very important. But above all, as part of our response to COVID, we said there is a need to have clear and gender-sensitive strategy to ensure availability of inclusive and long-term distance learning options for all boys and girls. Support and skill development of teachers with the aim of equipping teachers to provide quality distance teaching, because 82% of learners in Africa do not have access to internet. This Miriam and Prudiska spoke about. Then the other thing that we need to really, really look at is the aspect of finance. There's no way you can make any changes without finance. Money speaks, and money is very, very essential. If that is done, then we need to strengthen the role of teachers and communities. Where schools are closed, governments should support teachers, school staffing, and communities to ensure inclusive methods of distance learning. In those refugee camps, humanitarian efforts like what was done in Kigali by the president of Kigali, where he offered foodstuffs to some rural communities in Rwanda. And there are so in Addis Ababa, the PM once sent them food. You know, we have the school feeding program, and through the school feeding program, we feed the children. But now the schools have closed. How do we feed them? So we said it was very essential. We created temporary sites where they can go from within their walking distance of their houses to collect the foods that they need. So we also need to encourage girls to re-enroll. Evidence from the Ebola crisis shows that girls are at significantly greater risk of not returning to schools when they reopen. So government and school level stakeholders should identify policies that encourage girls to enroll. These include removing policies that are regressive and discriminating against girls. Like if a girl is pregnant, they don't have to go to school. No, that should not be it. We should create model schools for such kids. It's very, very important. And then we say that including bans on re-entry for pregnant girls, that should be lifted up, because the girl gets pregnant, the boy goes scot-free. Why? Why is it like that? So we should also provide support to girls and young mothers through flexible and accelerated learning opportunities, as well as catch-up courses. Then we remove school fees for now, because one of the speakers said, for those who have official jobs, they collect their salaries. Those who don't have official jobs, how do they get money to pay these school fees for these children? And then government should continue implementing Safe Schools Declaration, which is one of the things Save the Children fights for. Safe Schools Declaration. Sub-Saharan Africa already had the highest rates of education exclusion of all regions, with more than 2 million of children seeing their education interrupted due to insecurity, only in West and Central Africa before COVID-19 pandemic. Then government should protect schools from being used for isolation center. Educational facilities and temporary learning centers tend to be used as hubs for medical care in context where the demand for healthcare services and facilities exceed capacity. You gave me 2 minutes. I don't want to fail the exam. So I've stopped there, Doris. Thank you very much. And thank you for organizing this webinar. And thank you to all the esteemed participants and His Excellency from Burkina Faso. We appreciate the work you do at Save the Children, Doris. Thank you.
Thank you so much, Your Excellency. Now, can I invite Commissioner El Fadil to really make her 2 recommendations, but also give us her takeaway from this meeting. Thank you.
I think I have a list of recommendations, but we can share with you the document, Dorothy, but I will just highlight only 2. First, yes. First, we need to ensure that each response plan will be driven by the best interest of the child. And the do not harm principles in line with the African Charter on the Rights and Welfare of the Child. So we need to make sure that the Charter is implemented fully at this time of crisis. My second recommendation is to recognize maternal health and also gender-based violence, mental health, and psychosocial support. And all case management services are as essential and ensure continuity while sending out a strong message deterring domestic violence and gender-based violence. And also the reports that are coming out, they are telling us that there is an increase in the domestic violence. There is an increase on child exploitation, rapes, and dropout, because children are not at school. There is also increase in child marriage, FGM. So we want to make sure that children are protected at this time of crisis. These are my two main recommendations, but I will make sure that through my office you will receive the full recommendations. I do thank you again, Dorothy, for organizing this very important meeting. It's very important always to highlight children's rights, and also especially on the impact of COVID-19 on children. And there is also recommendations coming from the Peace and Security Council meeting that's been held this month, also on impact, COVID-19 impact of children. We need also to include these recommendations. Thank you very much. Thank you.
Thank you so much, Your Excellency. And I'm very pleased that you brought up the gender dimension of this pandemic. We know that the pandemic has a differential impact on children, especially girls. And so I'm very glad that you brought those issues to the fore. Now, very quickly, I would like to ask probably Marian and Praskovia for their concluding remarks. You have 1 minute each to provide your takeaway. Can I start with Praskovia and then continue with Mariam? So Praskovia, you have the floor.
Thank you very much, everyone, and thank you very much, Save the Children, for the work that you are doing to protect us as children in Africa. Thank you very much, our governments. Thank you very much for what you are doing, as in like the schools have opened, the examination classes have opened, and some schools have been donated with face masks, hand sanitizers, and safe water. But I'm here to appeal for others in Africa. The governments must think in those areas of opening schools for children, because we are the future leaders. So we would like to go back to school. Everyone, every child has the right to education. We would like to go back to school and be provided with face masks. In Zambia, yes, the examination classes have been opened, but some in rural areas.
Thank you very much, Praskovia, for your recommendations. Your call is definitely well heard. I also just wanted to note the presence in the audience of ECOWAS Commissioner for Social Welfare and Gender. We're very grateful for your participation, as well as the participation of several embassies from Canada, Sweden, Sierra Leone, Angola, and others. Mariam, you have the floor for your concluding remarks.
Thank you very much, Doris. For my concluding remarks, I would like to thank you for including Praskovia and I, because it's very important to include us in these very important platforms. So my takeaway point is, for one, to the parents, they should support their children and also teach them about the importance of mental health. And in the case of mental health, again, the leaders as well, the African government, should also sensitize parents about the importance of mental health, because it's very, very important at this point, because of the fact that things are changing, and it's a fact that many people do not know what to do about this whole situation. So mental health is very, very important. My last point is for the government to get their act together so children can go to school. Thank you.
Thank you, Mariam. I like the fact that you're always you really an incredible advocate, and you always go straight to the point, and you seek accountability from our member states. Now, Dr. Nyanyuki, I'll give you 1 minute for your concluding remarks, and then I'll invite Permanent Secretary Kapembwa to do the same.
Thank you, Doris. And I have 2 points in closing. And really, it's the importance of really bringing together everybody around the table and everybody ensuring that children are at the center of the conversations, of the policies and the programs. And when I say everybody, we need to have caregivers, communities, CSOs, private sector. All these people need to be around the table and be coordinated. And my second point is really how we are coming from a place where there's a lot of inequalities, where there are already pre-existing disparities. So the importance of using a social justice lens in the programs that you're going to put in, ensuring that those at the peripheries, those who are invisible, are really included. And it's not just about equality, but really equity that is stratified along the lines of inequality. Thank you, Doris, and thank you, everybody.
Thank you very much, Joan, for being so succinct and straight to the point. You have 1 minute, Director Mwila, to conclude.
Yeah, I think we want to thank you very much, Save the Children, the African Union, for this meeting. I think in the manner in which you have, brought it, I think for us, this is also a lesson. I think that, when you want to address the needs of children, no one organization can handle that. Even at national level, no one ministry or institution can do that. But you need everybody on board to come on board. The private sector, they bring in the resources, the government, they've got the machinery at district and national level. So I think for us, what we'd like to see is a multi-sectoral approach in terms of how we address issues of children. They are very diverse, and every player and actor needs to come on board.
Thank you, Permanent Secretary Kapembwa. Monsieur le Ministre, j'aimerais vous demander de nous dire votre mot de la fin, votre conclusion. Vous avez la parole, s'il vous plaît.
Merci. Je voudrais d'abord féliciter Doris pour la qualité de la modération. Moi, c'est la première fois depuis les différentes réunions Zoom qu'on organise que je vois une maîtrise du temps. Vraiment, félicitations. Je voudrais aussi remercier donc Save the Children, l'Union africaine et le collègue de Tanzanie pour le partage d'expérience qui me convainc dans l'idée que nous sommes dans la bonne direction. Et je voudrais, pour terminer, sinon je m'en voudrais, dire qu'ici, Save the Children s'est engagé à doter aussi certains élèves de cache-nez réutilisables et lavables, et aussi est en train de signer des conventions avec des radios communautaires pour pouvoir diffuser donc nos contenus éducatifs à la radio dans des zones où il y a un défi sécuritaire sérieux. Donc merci beaucoup à tous, et je serai heureux de revenir encore discuter au regard de la qualité de la modération. Je serai heureux de revenir encore discuter dans une autre réunion. Merci.
Je vous remercie, honorable ministre Ouaro. C'était vraiment un plaisir de vous avoir et merci infiniment pour votre contribution. So we come to the end of our dialogue. I know that there are a number of questions that have not been answered, but please rest assured that they will be answered in the report that we will issue of this dialogue. I would like to thank the panelists. I know we cannot applaud, and I think somebody needs to invent an app for being able to applaud on these platforms, on these webinars. And so I really would like to thank all the panelists, the fantastic speakers that we had this afternoon, and for their insight, for their recommendation, and for the practices that they shared during this meeting, during this dialogue. I would like to leave you with just and call on AU member states and all of us present at this dialogue to, of course, continue to be informed, to get the knowledge, to be able to respond and address the pandemic. So that's knowledge and information are key and central to containing the COVID pandemic. And then and that information needs to be available to all without any discrimination, whether we live in urban areas or whether we live in rural areas where there's no electricity, there's no running water. It is also important that the information is actually available on how to prevent the expansion and the propagation of the COVID in local languages as well as in child-friendly languages. The second word that I would like to leave with you is solidarity. Nothing can be done without solidarity, and I think Commissioner El Fadil talked about it. The Africa Union is coming as one to respond quickly and swiftly to this, and resources, of course, will be essential in addressing this pandemic. We are in this really together. And then the last two words, and in fact I had 4 words, the last 2 words that I would like to leave you with are action and accountability. Yes, words are important, the policies are important, but there's what is even equally important is action of all the decisions that we take at national level or at the AU level to address this pandemic. And accountability will be the only way to drive that action. On those, with those notes, I really would like to declare the Save the Children policy brief, COVID-19 impact on African children, protect a generation at risk, officially launched. You'll have copies available, at least for all the 500 people who registered for this webinar. You will have the link sent to you tomorrow, so you'll have the French and the English version of this policy brief. It's a landmark policy brief. Really, in closing, I would like to thank and applaud again the panelists for their brilliant interventions and recommendations. I'm not going to go through the list of the panelists, but I wish I had enough time to thank them, each one of them personally, by name, but I also would like to thank and applaud the wonderful audience online who participated and asked questions and made some comments, which unfortunately we couldn't have read. We had 2 additional questions that came in, but we couldn't answer them. And as I said, we promised to answer those questions in the report that we will issue. I also wanted to thank the Minister of, there are certain different ministries that participated in this dialogue on children, from Foreign Affairs from Ethiopia, and the Ministry of Health from Senegal, the European Union, the US House of Representatives, some members, youth organizations, leaders and donors, so DFID, Italian agency, the European Commission, USAID, UN agencies, and civil society organizations that participated in this dialogue. The audience and the question, I think, that were asked by the audience really contributed to enriching the discussion that we had today. I will be remiss if I did not thank the interpreters, without whom we could not communicate in the different languages, French and English in this case, and also my colleagues at Save the Children who helped, first who actually developed the policy brief, and a special thanks to Eric Hazard who led that process, and also all my colleagues at Save the Children who helped this meeting possible, this dialogue possible. Again, thank you for your active participation in this dialogue on the impact of COVID on children in Africa. Please feel free to continue the conversation on Twitter, on Facebook, using our hashtag #ProtectAGeneration. Have a fantastic day, and thank you again very much for your participation.